Okay. All right. So just tell me a little bit about how your group got started in their work.
We have a health coalition in our county, Ozaki County, and it focused on the priorities, health priorities that our community had said were the priorities, as well as our data, which was obesity, mental health, access to mental health care, and alcohol issues. And so when we applied for the Transform grant to get funding for the coalition, and we got the tobacco grant that worked on smoke-free housing and other tobacco products. So we added that leg to our coalition and started focusing on tobacco stuff. So
Great. So what's some of the work you've gotten accomplished?
we've gotten some apartments to go smoke-free. We have 5 different apartment owners that have made smoke-free housing in at least one of their buildings, some multiple. So that's been a great accomplishment. Other than that, done a lot of awareness about other tobacco products, and I've started diving into educating the community on those products and what youth are using and the issues with those. So
Great. So why is your community better now for the work that's been done with the smoke-free apartments and OTP education?
I think whether it's tobacco or anything we're working on as far as health prevention, it's part of the bigger puzzle. It's making our community healthier. And so this is just one piece of it. We're getting, in more smoke-free environments, living environments in our county. But it is part of the bigger health coalition, and, making our people healthier.
And now, what are some of the new relationships that you've built up? Like, I know you've gotten some apartments to go smoke free. What are some of those relationships that you've built up along the way?
Yeah, there's been a lot of relationship building, which has been one of the best things with this grant, and just the work that we've been doing with the Transform funding. Just meeting apartment owners and making those connections and talking about their options as owners and the things that they can do to impact the health of their residents. And as well, the partnerships we've created with other people in the community doing the same work, whether that's our hospital systems, our schools, people in the tobacco prevention program. Those networking opportunities and partnerships have developed over the past 2 years. It's been great.
Great. What have been some of the barriers you faced in doing the work, and how are you working to overcome those barriers?
Yeah. I guess barriers is just with the smoke-free housing, it's getting owners to actually follow through with the change. I'm realizing that it is important and that it is going to have a financial impact and a health impact. Another barrier, I guess, trying to think. That's probably the biggest one, just getting people to want to change, and reaching out, and the communication lines, that's probably been another barrier. Keeping strong communication and being that assistance to those owners.
So, you get the fun journey with this funding of first you thought it was coming to an end in this September. Then we told you it was not. Then we told you, JK, it is. So what would you do with another 2 years of funding?
We would have definitely, have more opportunity, time to impact more apartments in our county, as well as just spread the whole prevention and health message. Any work that we do is going to do that, spread the name of our coalition. So that would have been awesome, and we would have created more partnerships with people working in the field, as well as just the community in general. So.
Are there any strategies for any of the work you do from apartments to OTP, that any of those strategies that you really want to suggest, like, hey, this worked great and other people should try it?
Mm-hmm. I think there's not any specific strategy. I think for the other tobacco products and OTP work, just the awareness of the products, having the products, and getting out in the community and talking about them has been really successful, and people are really interested in that, especially the kids, just to see these products and how they're packaged. So that's been probably a good strategy, getting out in the community with the products that we're talking about. As far as smoke-free housing strategy is just meeting with different apartment owners. That's worked the best, forming those relationships, and then sharing success stories from other owners.
And tobacco control and prevention has always been really tied in with addressing health inequities, health disparities. Are there any specific areas you've worked in that have helped to lessen those disparities?
I think especially in our community, the renting community is in general a lower income population, and so I think that has really done a lot of great work for that population specifically, because it's targeting their environment that they're living in, and a lot of the other prevention efforts we're doing more broadly, like at schools. There would be city work we do, that's affecting the whole population. It isn't targeting that specific group. So that has allowed us to do and dive into the lower income population. So.
And last question here. We got to find a way to get funding to keep myself employed. Have there been any areas in which, other than just giving you the grant money, Transform Wisconsin or at the state level or the Wisconsin Clearinghouse have been helpful for you in doing your work?
Yeah, I think this grant has been awesome because it really had a specific, I guess, work plan, and it's really helped focus the work I do in this area. And some of the other areas we work in, they're not so focused. We're still trying to figure out what we exactly want to do, and this was kind of laid out. We had already chosen the path and what we were working on, so it really helped focus my work plan, and it's broadened my network. We've worked with so many great people, and I've gotten to meet a lot of other people from other communities doing the same work, so it hasn't felt like I was in one silo doing my own thing. I was part of a bigger state movement, so it's awesome.
That's fabulous. I know I said that was the last question, but this is a statement. Microphone is open. Anything else you want to say, go ahead and say it about anything.
Anything. I'm excited to go to Florida. Get out of the winter. No, this has been a great opportunity. It's sad that the funding's not continuing, but we'll move on. We'll just figure out how to continue the work in a different way. So that's all.
Great. All right, that is it. You can demicrophone yourself,
Nice.
and we'll go.